Hello everybody and welcome back to my channel. Today I will be talking about Group A Strep bacteria, which has received a lot of publicity recently and still continues to do so because of the fact that it is causing unprecedented cases of scarlet fever within our communities. In the UK at present, cases of scarlet fever are 2 to 3 times higher than they usually would be, according to experts. Coupled with this anxiety, several patients have faced challenges trying to obtain antibiotics to try and treat Group A Strep infections that have been occurring within our communities. Unfortunately and very sadly, several children have also died due to an invasive form of Group A Strep. Also worryingly, the numbers of cases of patients that are contracting invasive Group A Strep seems to be increasing. What we do know is that Group A Strep causes a sore throat, a rash and a fever, and it is highly contagious and infectious. What I thought I would do in this video is actually comment about how Group A Strep can affect the eye. So if you want to learn more about this, then please stay tuned. Before I get into the nitty-gritty of my video, I am a growing channel and I would be very grateful to yourselves if you could kindly subscribe to my channel, hit the like button and click on the bell icon to stay up to date with my videos and content. In terms of the eye then, Group A Strep commonly causes a bacterial conjunctivitis. I've previously made a video on conjunctivitis, so please do watch that to learn more about conjunctivitis. Also, the focus of this video will therefore be educating one about bacterial conjunctivitis. What this video will not cover is Group B strep infections, which can cause very severe eye infections, but that is a whole different topic altogether. In terms of conjunctivitis then, the conjunctiva is a very thin, transparent layer of tissue that covers the white parts of our eyes. The conjunctivitis diagnosis simply means that there is either an infection or inflammation or a combination of the two. Conjunctivitis can be caused by many different factors, but commonly it is caused by either bacteria or viruses. One of the most common causes of a conjunctivitis is a streptococcal bacterial conjunctivitis. In terms of symptoms that patients will experience when infected with a bacterial conjunctivitis, these include a red eye, possibly a sticky eye, a sore eye, a watery eye. One's vision may be slightly blurred. There may also be the sensation of burning, stinging and irritation. A Group A Strep bacterial conjunctivitis can initially affect one eye, but then worryingly it can spread across to the second uninvolved eye. In terms of conjunctivitis, usually when conjunctivitis is mild in terms of its signs and symptoms, it can self-resolve within a week without any active treatment. When the infection is at a certain point where it is no longer classed as being mild, then classically topical antibiotics are given to try and help to combat the infection. This will not only combat the infection, but try and prevent the spread of infection to the surrounding areas around the eye. Additional important treatments when one is focusing on a bacterial conjunctivitis include the possible use of cold compresses to help to try and ease one's symptoms, and also the very important aspect of trying to reduce the risk of spread of infection, number one, to the fellow eye, and then number two, to others that live around the patient. So for example, friends and family. Artificial tears can also be used to try and help to ease symptoms. The key point to remember here is Group A Strep infections are highly contagious. Therefore, every measure and step that we have at our disposal to try and reduce these potential risks should be actively and carefully deployed. The fundamental aspect of hand washing, which has become a cornerstone of each and every one of our lives in the recent past due to the COVID pandemic, is of utmost importance. The other thing to remember, which can be very difficult when one has a symptomatic eye, is to try and prevent rubbing the eye, itching the eye, and then subsequently rubbing the fellow eye, and then consequently and subsequently causing an infection in this eye. Other basic things to remember include not to share makeup and not to share towels with household members who may be actively infected. As this is an eye video, good contact lenses hygiene practices should always be encouraged. And with reference to this Group A Strep infection, if one actively has the infection, then contact lenses should obviously not be worn in either eye. If you have any of the symptoms that we have mentioned in this video, or you have other symptoms that pertain or potentially could indicate a systemic infection with Group A Strep, then definitely go to see your medical practitioner. Thank you so much for watching this video about Group A Strep and how it can affect the eyes. Please do share this video to try and improve and increase awareness of how the eyes can be affected, because there is a scarce amount of information out there when it comes to Group A Strep and the eye. Thank you so much. Until next time, take care, stay safe.